telling us everything we need to know. And we don't have a full explanation for these variations, but we have some explanations for them. So the virus moved east to west, so it hit the most populated parts of Wales first. And we know that this is a virus that attacks people who live close by one another. It attacks people in densely populated urban areas first, and the first part of Wales you come to as you move west to east is the most densely populated areas. We also know that it is a virus with a strong socio-economic component. So if you are older and sicker and poorer, then you are more vulnerable to the disease than you are if you don't share those characteristics. And Wales has a population that is older and sicker and poorer than the United Kingdom as a whole. So you're seeing some reflection of that in these figures as well. Does that underpin the approach we are taking? Yes, it does. Because coronavirus is absolutely not over here in Wales. It still poses a risk to the health of people who are vulnerable, who are faced with it, could have a very bad experience. We can still do more, even than we have done already together, to combat the disease, and that's why we are taking the approach we are in Wales.
For my second question, I've been out in Cardiff Bay all morning chatting to people who are out exercising here, getting their views on the different approaches. And I have to say, there is broad support for a cautious approach, but among those who question why you're taking a different path, many people question the practicalities, given how many people live and work on opposite sides of the border, and of course people travelling for leisure purposes. And some have said to me that they wonder, given the impracticalities of having different rules, whether there is an element of politics at play, that if there was a Labour government in Westminster, perhaps you would be taking a more similar approach than you are at the moment.
Well, on the final point, I want to be clear that that plays no part whatsoever in our thinking here, nor do I think it plays a part in the thinking of the UK government either. In all the discussions that I have had with them, the issue of party politics has never once entered into the discussions on either side of the table. We are, all of us, in the different circumstances we face, joined together in trying to do our very best to protect the public across the United Kingdom from the onset of this disease. On the more general point, I think people are right to be concerned about the porous nature of our border and the difficulty of messaging on either side of it. It's why I've been throughout keen on a UK-wide approach. And I said in my introductory remarks that we still have a UK-wide approach in my mind. The changes we are making in all parts of the United Kingdom are modest, and they are all in the same direction. They are all about trying to find those first cautious steps that we can take to begin the business of lifting lockdown. So the fundamental approach remains a UK approach. We are used in Wales to the fact that with a border, we have differences on either side of it. There are some particular challenges in getting those messages over in this context. I wish the UK government were sometimes clearer about when they are speaking for England and when they are speaking for the UK, and I didn't think that was as clear as it could have been all the time yesterday. But nevertheless, we will use all the means we have to try and make it clear to people when they are in Wales, it's the Welsh rulebook that applies, and if you come across our border and you need to have that explained to you, then we'll make sure that that explanation can be readily made available. Thank you. To Mark Hutchins of 5 Live.
Yes, thank you, First Minister. Just to pick up then on that last point, there are 4 governments in the UK. There's only one virus, though, and as infection rates go down, the confusion rates seem to be going up. Aren't you, in all governments, letting people down by failing to come up with a more joined up, less confusing approach?
Well, I don't believe that is the case, Mark, because as I've said, if you look at the big picture here. If you look at the changes being made in all 4 parts of the United Kingdom, all of us are doing modest things. So no one is suddenly charging away and trying to act as though coronavirus is over. And the changes that are being made in all parts of the United Kingdom are all in the same direction. It's not that some parts of the United Kingdom are tightening regulations and some parts are loosening them. We are all finding those modest steps that begin the process of lifting lockdown. And I'm very pleased about that because I want a UK-wide approach. But 20 years into devolution, surely nobody should be surprised if governments in Scotland or Northern Ireland or Wales calibrate their approach to meet the needs of their particular circumstances and populations. And that is what we are doing. It's why we announced our modest changes on Friday, and we will go on making decisions that reflect the position on the ground here in Wales and the responsibilities that are ours to exercise.
Coming out of lockdown is clearly going to be harder than going into lockdown. And you mentioned what happened over the bank holiday weekend, and particularly with those VE Day celebrations. Sometime along the line, you're going to have to cut people a bit of slack, aren't you? Are you worried about people's behaviour and trusting to common sense, given what happened over the past weekend?
Well, again, I think if you look back over the 6 weeks, the major message you would take is the astonishing commitment the people in Wales have shown to complying with the regime we have all had to live under. I mean, if there's anything remarkable, it's about how willing people have been to abide by the rules. So while we saw some things over the weekend that I'm keen that we don't see repeated, I don't think how keen people are to do the right thing. Now, we have to find a way out of lockdown that capitalises on that and finding the right measures at the right time that take people with us and draw on that enormous reservoir of willingness there is in Wales to act collectively to solve common problems. And I think we're lucky to have that culture and to be able to draw on it, but we will still have to move carefully and thoughtfully to have a dialogue with people in Wales, and that way I remain confident it will be possible to lift the lockdown, which is more complicated than going into lockdown. I definitely agree with that, but to do it in a way that allows people in Wales to go on playing the part they have demonstrated so powerfully they want to play in combating the disease. On to Adam Hale at PA.
Thank you, First Minister. Plaid Cymru called for travel restrictions to be put in place, if necessary, between England and Wales. Is it practical, and would you consider doing that?
I don't think it is practical. I think there'll be enormous practical difficulties in the face of doing that, nor do I at this point see that it is necessary. Now, as I said, we talked to our chief constables and police and crime commissioners throughout the week. And I've always said, if they were ever to say to us they need more powers or there are further things that we can do to assist them in the difficult job that we ask them to do, then of course we would consider that positively in the Welsh Government. Restrictions of the sort that have been referred to there have not been part of that conversation, and at this point I don't see the case for them.
Thank you. And were you caught off guard slightly, surprised by the UK government announcements that places like golf courses can now open up from Wednesday in England? And what are you saying to the Prime Minister and members of the Cabinet and the UK government about improved clarity between what applies to Wales and what merely applies to England?
Well, what I said to the Prime Minister yesterday is what I've been saying to the UK government over the last 3 weeks. I wrote to Michael Gove 3 weeks ago today asking for a regular pattern of engagement between the devolved administrations and the UK government over the last 3 weeks so that we shared information throughout the process, we informed one another of our thinking, because the more you talk and the more you share, the better chance there is that you can move together. Now, we didn't have, in my mind, that reliable rhythm of contact between the four governments over the last 3 weeks. Where we had it, it was good, but it was too, as I've said before, it was in fits and starts. And I don't think that that is sufficient to deal with the committee that Mark Hutchins pointed to of trying to come out of lockdown. So I made a point again to the UK government. Let us have a reliable, regular rhythm where every single week we get together, we share intelligence, we share thinking, and we aim, as a result, to put together a plan in which we all move in a common direction with a common set of measures, albeit calibrated then to the local circumstances. Adam, thank you very much. I'm going to go to Rupert Evelyn of ITN.
Thank you, First Minister. Just picking up on that point there, in terms of your relationship with the UK government, your health minister said an hour or so ago that the balance was wrong and that COBRA is lucky enough to meet now twice a month. Do you think that they are shutting you out in terms of the overall UK decision making?
Well, as I said in answering Adam, when you get conversations with the UK government, they are helpful, they are worthwhile, and they don't proceed on the basis, I think, of trying to shut us out of conversations. It's simply that they haven't been reliable and routine enough to get the maximum out of the engagement that I would like to see. And for COBRA to meet twice a month is not sufficient. It doesn't allow for that opportunity. But I make these points always because I want the UK to succeed. And I want the component parts of the United Kingdom to have the proper opportunity to share information and to come to common results. Now, I hope that that will improve over the next 3 weeks, and it needs to, because these decisions get more complicated as we go along, and the more complicated they get, the stronger the case for that regular, reliable rhythm of engagement becomes.
Thank you. I think the term you used earlier in terms of what's changed between England and Wales was more about tone than substance. Clearly, that will have an impact, even if you feel that the regulations are broadly similar. How worried are you that a more liberal tone in England will impact on the rate of coronavirus cases in Wales?
Well, I have to be concerned about that because we have worked so hard to lower the rate of reproduction to the point where last Friday I was able to announce the very modest measures that we will bring into force this afternoon, because that bit of headroom we have is headroom we want to use, and I don't want to see that headroom eroded by a wider circulation of the virus because people are exercising freedoms they have elsewhere but they don't have them in Wales. So I am concerned about it. I draw comfort for what the Prime Minister emphasised yesterday about his determination not to do anything that flies in the face of evidence that coronavirus is beginning to take off again, that he wants to move in the most careful and cautious direction as well, always informed by the science and the best medical advice. And so long as we stick to that and stick together on it, I still think we will be able to work very satisfactorily across governments in the United Kingdom. Over to Mike Hughes of Global.
Thank you, First Minister. Just picking up on a point that Mark touched on earlier, there will be people out there that don't follow devolution, who live on the border with Wales or might live elsewhere in England, who don't follow Welsh media, and will be confused by all the different messages at the moment and inadvertently break the rules on movement. Given all that, should the rate of infection increase in Wales and more people die, who should take responsibility for that? The public who break the rules or politicians?
Well, Mike, I think there are an awful lot of ifs in that question, and I'm not sure that I can give you a very sensible answer to it. Where people inadvertently break the rules, then the approach we've always taken in Wales is one of education, explanation, And for the vast majority of people, when they have things pointed out to them, they act again in the most responsible way. And my aim in Wales throughout this has been to make sure that the people of Wales are involved in our decisions, that we talk with them, we share with them the information we have, we try to do it together. It is not a matter of the people doing one thing and the government doing another. And from what I have seen over the weekend, the decisions that we announced on Friday are supported here in Wales, and acting together is by far the best way and probably the only way in which we can all succeed together in reducing the impact of coronavirus and beginning that journey back to what we once thought of as normal.
And can I just pick up on a question that Adam asked in regards to the messaging? Did you specifically ask the Prime Minister yesterday to be clear in his address about what applied to England only and what didn't? And if so, what was your reaction when you learned that he wasn't going to do that?
Well, that point was made to him not simply by myself, but other First Ministers, that it was very important. Some of the things the Prime Minister talked about in his address are UK-wide measures. When he's talking about border security, for example, that's not a responsibility devolved here to Wales. But we did, I think all of us, ask for clarity when he was speaking, about when he was speaking in that UK capacity and when he was making announcements that apply only in England. I know it's complex and I know it's a challenge to get all that over in a single statement that you are making. My own view is that more could have been done, and it would have been helpful to us all if there had been a greater emphasis and a greater degree of clarity on a separation between when the Prime Minister is speaking for his UK-wide responsibilities and when he was making announcements that applied only for England. Will Hayward of Wales Online.
Thank you, First Minister. Just to clarify some confusion, if someone wants to meet a member of their family in a park, as long as they maintain social distancing, can they? And if so, what about if they wanted to meet two members of their family?
Well, the rules in Wales are that two people can meet, provided they observe social distancing. So if one person from a household is going out, meeting another member of their family, observe that social distancing, then under our rules, that would be permitted. You can't go above two. Once you go above two, in our definition, it becomes a gathering, and gatherings are not allowed, because the more people who meet, the greater chance there is that the virus will start to circulate again.
Okay, thank you. And has this crisis exposed any problems in our devolution settlement? And can you outline changes to that settlement that could have made it easier for you to protect people in Wales?
Personally, I don't believe that the devolution settlement itself has got in our way during the crisis. I think that the crisis has demonstrated the strength of a devolved United Kingdom, able to operate together for a common purpose and draw on common resources. I think it was only this time last week I was talking about the way in which on PPE we have been able to supply other parts of the United Kingdom and have been able to draw mutual aid from other parts of the United Kingdom when we have needed it. That's a strength of being part of the United Kingdom. But in a devolved United Kingdom, we're also able to make decisions that are right for the particular nations that we represent. So my reflection on the devolution question in the coronavirus context is that it has been a strength, and that it has demonstrated both what we get out of being together in the United Kingdom and what we get by being able to make decisions that are right for Scotland, right for Northern Ireland, right for Wales, and as the Prime Minister did when he was speaking for England last night, right for England. Thanks, Will. Rob Taylor, Wrexham.com.
27 days ago, your health minister said he would prefer a modest backlog to testing rather than not enough referrals. He also said he wanted Wales to maximise the use of capacity that exists. Manchester City Football Club car park is seeing a similar amount of tests as the entire of Wales. And here in Wales, 100% of testing capacity is still not being used despite the small overall figure being available. What's the blockage in the system that means that capacity is still not being used? And will we be asking the same question in a month's time?
Well, we'll be publishing the latest figures today on testing, as we're committed to doing every week. They will show a significant rise in the number of tests available here in Wales, and they will also show that the figures of the number of people we are testing each day is higher than it has been at any time during the coronavirus crisis. So I think we will be able to demonstrate conclusively that things are moving in the right direction, and that there is some acceleration in the movement in the right direction. I still think there is more that needs to be done to make sure that we are making best use of the testing capacity that we have. And we are using some help from the Army here in Wales to iron out some of the blockages which there have been in slowing down the ability of individuals and settings to get the testing that is available. So I think we made some progress on that. That was the news from our local authorities last week, but I agree that there is more that still needs to be done to make sure that those people who are entitled to a test and should be getting a test in Wales get the test, because those tests are available.
And secondly, Dominic Raab said UK government will from Wednesday encourage face coverings when people are in enclosed spaces or with people who don't live with. Are you seeing the same science, and will there be a similar announcement for Wales? And if so, when? And if not, why not?
So I've had formal advice now from the Chief Medical Officer on the issue here in Wales, and the advice I have is that where people use non-medical face coverings in non-domestic settings, there is a marginal public health case for it. It doesn't protect you, the wearer, from anybody else, but it may protect other people from the risk of you infecting them. So the advice I have is that we should not consider making it mandatory, because the evidence is not strong enough for that, but where people feel that this would be something that would offer them confidence that the case is there for them to do it, provided, first of all, that it is a non-medical face covering, so we're not competing for face masks with people who need them in clinical settings, and secondly, that people don't take a false confidence from doing it. If you are symptomatic, if you are coughing and spluttering, you should not be out. And wearing a non-medical face covering is not an excuse to do something that would be risky. So provided we do it in that way, if people feel that it would be the right thing for them to do and gives them confidence to use facilities that are available, then the advice to them in Wales is they should go ahead and do that. Thank you, Rob. To Nathan Shoesmith of The Speaker.
Thank you, First Minister. Can you clarify how close Wales will be following a similar policy announced to the UK in terms of the test, track and trace policy, and in particular whether people in Wales will be encouraged to download the NHS app when it is rolled out?
Well, we will be definitely following a test, trace, track system here in Wales, because that will be a necessary component of any moves to lift lockdown. We are positively interested in the app that is being trialled on the Isle of Wight, but it is a trial, isn't it? So nobody is able to commit to using it while the trial is still underway. So we have a place on the group that is overseeing the trial to make sure we get all the information that we need from a Welsh perspective. There are issues to do with personal data that still need to be resolved, and we will learn from the way in which having an app affects behaviour amongst people in the Isle of Wight. But provided any issues with it can be satisfactorily ironed out, we have a basically sort of positive attitude towards the app and its application here in Wales.
Thank you. And the second question, it's widely thought that social distancing will be in place for some time, even after lockdown measures have been eased. What message do you have for students at Welsh universities and schools, many of who are concerned that they may not be able to physically return to campuses, university halls, etc., for closer to a year rather than months to come due to social distancing?
Well, I agree, Nathan, with what you said at the start, that I think social distancing is with us for quite a long time to come, and that partly will be because of choices that individuals make as a result of having lived through this experience. Here in Wales, we are working very closely with our higher education sector. We've always worked closely with NUS Cymru too, and our Education Minister will be making further statements this week on our planning in relation to school return. So we understand the concerns. We work closely with the sector, and we will make sure that there is Welsh-specific guidance and information available to people as to how we will navigate our way through this in those particular sectors. Tom Magner of Carers World Radio.
Thank you very much indeed, First Minister. You've heard a lot, obviously, this morning about potential differences between England, Wales, Scotland, Northern Ireland, and now we appear to have Manchester saying they might go their own way, according to the Mayor's office. With all of this complexity, doubt, what's your best message to unpaid carers at home with all this worry about COVID-19 itself on top of everything, and particularly if they live on the border between Welsh law and English law?
Thank you, Tom. Well, look, my main message to people who are carrying out unpaid caring duties at home is just to thank you for everything that you do, in the coronavirus crisis and before and after it as well. We rely hugely on that enormous reservoir of unpaid care and compassion that we have in Wales. And in the coronavirus crisis, my message to carers is that you are doing the right thing, because we know that carers are abiding by the regulations here in Wales, that they take enormous care, that when they have to leave the home, they only do it for the most important reasons. They do it in careful ways, and they do it in a way that discharges the responsibilities that they have within the home. So my message to carers in Wales is thank you for everything you are doing. You are doing the right thing. Carry on doing what you are doing now.
Those viewers with disabilities are telling us, well, that not just today, but across the whole of this lockdown, that no one in the Four Nations has specifically mentioned people with disabilities, and in particular in terms of present planning and maybe the future. Can you assure them that there will be a specific involvement?
I absolutely can, and there is in Wales. My colleague Jane Hutt, the Minister with responsibility for equalities, has met with disability organisations in Wales in order to make sure that we capture the particular experience of disabled people, and we have issued new guidance in the last couple of weeks to social services departments in Wales about the way in which they are assessing the care needs of people with disabilities, and to make sure that amongst all the very many competing things that local authorities are having to do, that the needs of disabled people are not overlooked. So for disabled people in Wales, I really want people to know we are in close dialogue with organisations that speak for disabled people in Wales, and we are taking action based on what they tell us the experience of disabled people has been in the coronavirus crisis. And finally for this morning to Andrew Nuttall from The Leader.
Hello, First Minister. So we had a number of our readers get in touch with their concerns about people crossing the border from England into Wales, and then also vice versa, obviously due with the confusion. We've had one person get in touch to say that from their point of view, they want to know when they'll be able to see their children, their grandchildren, their family that live across the border. If Boris Johnson is now saying that people can drive to exercise, why can't people drive to see family members? Because it's now getting on to 2 months since the lockdown was sort of imposed. And we know it's obviously a devolved matter, but we've had people also get in touch about schools saying if the UK government are now thinking that it's safe to send children back to schools as early as June, obviously with however many mixed households that may be in a classroom. We wanted to know sort of why people are now still unable to see their family members after months apart.
Okay, Andrew, thank you. And I see absolutely why those are issues that are especially relevant in the part of the world that the leader provides a service. But my real answer is on this, is that I think we have got it right in Wales, and I don't think they've got it right over the border. Our restrictions on people's ability to travel are there because we don't want the virus to travel. And the further people go, the bigger the risk is that coronavirus will start to spread again. That's why we say to people in Wales, stay local, because that reduces the risk. And I've got huge sympathy with people who have relations across the border, and you know that applies to a huge number of us in Wales, and we miss a lot our ability to have that direct face-to-face contact with people elsewhere. And it's part of the sacrifice we are all making. But we are making the sacrifice for a very good reason, because behaving in the way that we are really does protect ourselves and protect those other people. We mustn't give up on it. Now we're doing the right thing in Wales, and by doing the right thing, we are actually hastening the day when it will be possible to begin to lift those restrictions and to allow people to get back together again.
Thank you. Secondly, we've also had a few people get in touch, obviously, with the deviations between this UK-wide approach that we've heard so much about from all the developed nations working as one to find the best way to tackle this virus. So with these mixed messages in the last couple of days, to say the least, and the differences in the restrictions now, however slight they may be, we just wanted to know sort of how are we meant to be giving our readers that reassurance that the government are helping us to beat this virus if we can't all agree on the one sort of best way to tackle it.
Well, look, I think the message for your readers and people in Wales is there is a UK-wide approach. We are all heading in the same direction, and we're all doing it at the same sort of pace. All governments are acting cautiously, all governments are doing things incrementally, and the steps we are taking are all in the same direction. We are all marginally lifting the restrictions. So there is an approach that works across the United Kingdom, and we are very determined to go on helping to make that happen. What we do is we then apply that sense of direction in the particular circumstances we have in Wales. It's why we put that 2-metre rule into the law here in Wales, because we wanted to give people confidence in the workplace that their safety, their health and well-being was being properly attended to. It's why there are some of the differences that we've been exploring this morning, but they are differences at the margin. They're at the edge of what we are doing. The big picture is of a UK-wide determination to work together to beat the virus, to put people's health first, to move to lift lockdown in the most careful way we can, always with the main eye on the impact on people's health, and then to take the decisions that work for Wales, just as other people will be making decisions that work for Scotland or England or Northern Ireland.